It's only good afternoon, folks. It's only what I don't know, the 12th or 15th town hall I've done, and I started off talking to you with the mute button on. Um, thank goodness for Michelle in the other room who screamed at me that I was talking away. So welcome to our town hall for Thursday, October the 1st. Again, I'm not sure how many we're at now, but this is certainly well into the teens for our town hall. But for the folks who don't know me, I'm Bruce Squires. I'm president of Children's Hospital, VP Women's and Children's Health. I actually thought I had set my light up better. Looking at Wendy, I didn't as well as I'd hoped, so my light isn't great, but sorry about that, folks. We have been doing these town halls really throughout the pandemic as an opportunity to connect, to share information as appropriate, and ideally to create a little bit of a two-way communication through questions being submitted and me working to answer them. It's a little bit of two-way. It's not as two-way as I would like, but we have, I think, heard throughout that there were benefits to this town hall. I love seeing folks and having the opportunity to talk to you, and so we will keep doing this as long as is appropriate. We've always endeavored to check in on the evaluations from previous town halls, and so I'll report back that at our last meeting we had a slightly higher sort of is it valuable response rate at around 80%, 85%, but a little bit more in the kind of the somewhat valuable, and so certainly want to pay attention to that. Not quite clear yet what adjustments are necessary to make it more valuable, or again whether it's context specific. And so we'll talk a little bit about context again in a minute. And so we did ask questions around timing of these meetings, both what time of day, but also frequency is a timing question. And so I do want to speak to that for a moment. Folks, you'll all be aware that concerns are starting to grow with respect to COVID activity in this province. Primarily the growth and the significant numbers of COVID infections are being seen in the Peel region, in Toronto, and in Ottawa. We've seen in the Hamilton area and in our surrounding region a small increase in the daily average number of new cases, kind of gone from in the 5-6 range up now to the around 10 new cases today, per day. Those numbers, different from the fall, are primarily in the sort of the 20 to 39 age group, sorry, different from the spring. Now they're primarily in the 20 to 39 age group range, whereas they were heavily in the seniors population back in the spring. That's good in many ways because we're not seeing at this point, and history hasn't shown a significant burden on the healthcare system from infections in those lower age groups. So that's a little bit positive. But perhaps on kind of on a related concerning side, it appears that many of those, if not most of those infections, are happening in the community because of, if you like, not ideal compliance with public health measures. And we're starting to see some variation there. What does that mean? Well, I've said many times, I've written about it, and I know many of us have talked about the risks associated with another severe second wave. The risks for the general population, but let me talk specifically to us and to our areas of responsibility. We know that participation in on-site school is incredibly important and beneficial to the current and future health and well-being of kids. On-site school is an ideal mechanism for physical, mental, emotional, social, and obviously learning development for kids and youth. And so we know that the chances that we have to go back to something other than on-site school are increased with increases in the level of COVID activity in the community, and with the necessity, the decisions that might happen at the provincial level and regional level to ramp up, or if you like, ramp down, increase the public health restrictions, the restrictions on activity. And so, you know, while things are both getting a little bit scary in terms of the increases in activity across the province, from the perspective of, from many perspectives, but I want to focus on the perspective of us maintaining our ability to care for kids, for kids and families, and the ability for you to be able to do what you love and to stay doing what you love. We're still at that point, I think, where with diligence, with care, and with attention, that we can model and we can lead, that we can help the public to flatten that curve. And I did hear from Dominic Mertz earlier today that, you know, there might be some indication the last few days that although Ontario has been experiencing a significant growth, and that RT number is still higher than 1, which means you're gonna increase the rate of new cases per day over a five-day period. Although it's still higher than 1, it has perhaps been flattening. So I'm emphasizing this because, well, for a few reasons. One is just to encourage all of us to continue to be role models in supporting, you know, doing what it takes so as to preserve hospital and healthcare capacity for kids and families, but also, again, to preserve the ability of us to keep schools open. But I'm also highlighting it again because, you know, we went through in the spring a period where we didn't know a lot about COVID, and we weren't sure what was coming, and we had very high rates, and that led us to have to really significantly reduce the level of service that we provided, the care that we provided. It went so far as resulting in the shutdown of the Ron Joyce Children's Health Center, and also went to really severe restrictions in the amount of surgery and procedures we were doing, and the availability of on-site ambulatory care, even at the Children's Hospital that stayed open. And the last thing that I want to see happen is that we get to the point where we're seeing that reduction again, because we've seen and we've been talking about quite publicly the impact that has had on access to care, and the fact that an impact on access to care has real current and long-term implications for the kids and families that you serve. And many of you have talked to me very specifically about the impact on the individual kids that and families that you see. And you know, I want to acknowledge that I made mistakes. We made mistakes in the start of this, in terms of I'll phrase it this way: not doing enough at the right times to get back to care as quickly as I look back we should have, in a number of areas. You know, I kind of, the more I think about that, the more concerned I become, and the more motivated on the positive side, but also just the more affected by the fact that I'm convinced we we should have gotten back more quickly and pivoted in some areas to transition care for kids and families. And so that's looking back, and honestly, I want to acknowledge that and express my to many of you, because it affected you so directly. My apologies. But also kind of looking forward to keep that lesson in our mind about how hard we're going to work to find that balance. For sure, there's got to be, we have to do everything appropriate, everything that we can to protect your health and safety and the health and safety of kids and families. But we have to ensure that in doing that, we also do everything we can to maintain levels of care and not over-rotate or go further than we need to. So I'm still hopeful. That's kind of a somber message in this. I'm still hopeful that the work that we're modeling as a healthcare community to support public health measures. You've seen leaders like Rob and myself advocating really publicly for an awareness of how important and how valuable sort of public participation and compliance measures will be. And I'm hopeful that'll have an effect to help us to dampen that curve and to sort of facilitate us continuing care. So I'm hopeful, but I also want to highlight that even if some of those measures are not as effective as we would hope, we've learned from the first wave, and we will be able to do, I believe, and have to continue to strive to do that much better of a job in finding that right balance for you and for the patients and for the families and caregivers that we serve. Let me say one more thing on that, and I know there's many leaders on the line right now, and so I really want to help leaders to help to support this. This is, and even it'll come off a little bit in my message. It's a time where there may be rising levels of anxiety about what we're facing, and about the possibility that we're gonna return to some of the difficult challenges that we faced before. It was a tough time. You all worked so incredibly hard in very difficult situations, and understandably got tired, and that there can be harm from that. I think that we are again, we're preparing ourselves better. We've learned from that. And I also hope that you can count on each other. Like I saw that in the first period, how well and much we supported each other as individuals, up and down throughout the organization. And so when we've got ideas about how to support each other, I encourage you to continue to bring them forward. And that means, what can someone else do for you? Speak up and highlight. But also, of course, what can you do for others? What can you suggest that we do for others? So I've spoken a bit to that, obviously, because I think we're perhaps at the point where folks may be pivoting in their mind around what's coming, and so I wanted to address that directly. I've already spoken now to some of the questions around the child health advocacy and kind of the focus on keeping services open. So I'm going to skip a couple of the questions that came in because I dealt with it, but I want to address some of the others that have come forward. So let me deal first with testing, because it's definitely coming up. So good morning, Bruce. I was wondering if HHS has considered opening COVID swabbing up to staff's immediate family living with them, specifically children sent home with noses. There is quite a lag in time at some of the community labs. I am aware that some hospitals in the Toronto area have already moved forward with this. So that is actively being worked. It was addressed earlier today. I don't have the answer yet. We haven't figured it out as to how and if we're going to be able to do that. But there's an acute awareness of the implications of delays in access to testing, the challenges to get testing, and honestly, right now, the biggest challenge across the province is in lab capacity to process the tests that come in. And so then we feel that, you feel that most acutely in your workplace, and again, as critical essential workers, and driven, more by the fact that kids are back at school and the algorithms for school attendance are relatively strict in terms of having kids come home. So acutely aware of that, actively working with the experts across HHS. But honestly, I'm afraid I don't have the answer yet to say that we're going to be able to do that. I don't know if we will, but we're certainly trying and considering it. Wondering if why employee health is not swabbing staff in light of the upcoming closure of the Urgent Care Assessment Center. Seems the optimal time to revisit this and have the process in place prior to the upcoming closure in the beginning of the flu season. So let's be clear. EHS is swabbing staff according to your self-assessment and those requirements. So continue to complete your self-assessment, and if it comes up inappropriate, then as per the instruction, you'll get your call or you call in, and swabbing is still happening. I want to differentiate between the previous question, which is really kind of around asymptomatic and around how we facilitate with kids coming home. And just kind of another question in this area is asymptomatic testing still continuing for staff? Staff need to connect with the EHS if they have concerns and need direction. So really there aren't changes at this point in the COVID testing protocol. So continue to follow those screening questions. You may have heard, I shared with others earlier today that certainly the screening questions are really the COVID symptom list is being discussed at the provincial level. Many folks are aware that that BC has gone with a different symptom list from Ontario, so that is under discussion, but they haven't changed it yet. Okay, so we're not at a change place yet. I'd like to submit this question to the town hall. As we move forward to phase 3, will there be consideration given to changing the daily patient paper list supplied to screeners? I won't read the rest of the question, but there's many descriptions of some of the challenges we're having, and I absolutely agree and support this. So they're working very hard on options that include laptops and tablets. So I'm hopeful that we'll begin to find some mechanisms to facilitate the timeliness and the accuracy of those lists. In the meantime, ask folks to still do as much as you can to be diligent there. Staff who were redeployed to screening being allowed to claim mileage for traveling to various sites during the initial stages of COVID. As some managers chose only half of the staff in a department to be redeployed, it seems an additional unfairness to have added expense, both in cost and in time. Just give me a second here, because I did get an answer to that, but I realize I printed the wrong list, and I don't know the answer there. So I'm just going to take 1 second as quick as I can. Shoot. Sorry, folks. Oh, there we go. Sorry. Okay. I'm going to go back to that. I apologize. I do have a list, but maybe Michelle could bring it in, but I'm having trouble with my computer. Can you please address the policy revacation carryover? It seems to be different across departments. It is different across areas of employees, unionized and non-unionized. So I'd ask you to, and it's quite detailed, so I'd really ask you, can you send me in that question, or check in with your manager, but certainly don't hesitate to send it in very specific for your question to make sure that I get that right. When will Sunnyside Cafe be opening? Really missing Wes and Kelly. Absolutely. And I talk to Kelly she's often at MCH, so I'm seeing her there sometimes. You know, I'm really desperate's the wrong word, but really wanting that reopening to happen. We don't have a date yet. We are looking at that. The facilities team is looking. So as soon as I find out, I'm gonna share as well. It's an important and such a valuable piece of as at each of our sites. Our cafe teams are so great. Thank you, Michelle. Our cafe teams are so great that they really do kind of express the culture of the organization and bring the smile and care. So I'm keen for that to come back. In terms of opening more entrances at Ron Joyce, also had that question. Not in the plans right now. I wasn't aware that that there's kind of significant challenges associated with kind of the controls on staff entrances. So I'd be interested in kind of hearing more about that in terms of kind of what are the challenges created by what we're doing right now. So hope folks can help with that. Let me go now to address just a couple of the other topics that came up and from our evaluations from the last time. Technology and space needs for virtual care. Employees are really struggling with this. We need to know what the organization is thinking and planning for our future vis-a-vis virtual care. So I can't give you all the answers there, but I can share a couple things. Across all of our sites have asked the teams to help us, here it is, to help us in identifying mechanisms to create virtual care specific locations and space. We have challenges, but challenges around space, but we're working to provide those opportunities. We also have created a virtual care operations team, and it continues to include from our group a number of folks, and now that we're up to a sort of 5 FTEs working in that area, they are going to be focusing on helping the organization to manage and to really develop a viable plan for optimizing virtual care. So we're going to have an update on that over the course of the next few meetings, and spend much of November laying out a plan. So a lot more to come there. Will flu shots be offered to staff, and how this year? A year more than ever, we need to ensure staff are receiving them. So I agree, and that falls into the kind of the earlier discussion we were having around exploring mechanisms to facilitate testing for staff and families. So both of those are being worked at this point, but don't yet have how we're going to address that. Let me now loop back to those couple of questions that were a couple more of those questions that were raised with me. Wondering about parking garage delays. Since most clinics, schools, and ambulance services have resumed, why can't the gates be open for rush hour again? So parking office has indicated the reason why we're not in a position to keep the gates to the south garage open during peak times is that we've come across multiple staff who are trying to take advantage of the previously free parking and parking there when the gates are lifted. So we're needing to ensure that those who should not be parking in the south garage don't. Because of that, we've had to keep the dates down. We have been successful in using due diligence to employ the intercoms. And so the parking team is aware of the challenge and is monitoring when there is a significant backlog to accessing the garage. So for example, yesterday, the gate was temporarily lifted when there was a backup. So thank you to Elizabeth Question and her staff for that work. Let me just check if there was any others here that I can help with. No. So 256 celebrations. Let me just highlight. I wanted to get to so many things to celebrate over the last period of time, but let me just point to a couple. The 4B1 team in maternal and fetal medicine. They've moved that clinic now 2 times, and it's extremely high volume and very complicated clinic. They've now moved it successfully twice in the last 6 months, and that's just above and beyond. And I hope we've done some things to improve what we're going to be able to offer, but really have to acknowledge and thank and celebrate that team. Our autism services have now moved to home visits, have created the foundation program, have moved to the relaunch of the urgent emergent care service, pivoting on a dime. And so just huge celebration and thanks out to that team, and congrats. We have our Growing Together guide out now for services available out in the community. This is where we're providing leadership to the community and accessing what you need. So a great celebration there. It's OT month, so and we're just coming off Childhood Cancer Month, Cancer Awareness Month. We're coming off of yesterday, obviously Orange Cert Day, a very important day which many of you recognized. So celebrations recently finished. Celebrations begin, and you know, the difference that our occupational therapists, like so many of our therapists, make for young kids and families can't be understated. So thank you to all of you. Highlight that United Way campaign is just underway, and kind of celebrate that in the sense that one of our own, Lisa Webster, is one of the corporate leads there. But again, it's giving back to our community. So highlight that and encourage everyone to take advantage. And I guess a celebration, we received a donation of essentially a box of Grow Guide cookies for everyone who works at HHS, works in our team. And I think, again, that's a recognition of community respect for what you do. But I hope you can celebrate by getting a chance to enjoy that little treat. So as we wrap up, I'm going to draw here again for another treat, which is the M&M gift certificates that have been donated. And so I'm going to name DJ Pridmore, who is one of our PACU RNs. So DJ, congratulations. Another winner here. So Burnett K, in the Spina Bifida Clinic, one of our physical therapists. So thank you, Burnett. Congratulations. And last but not least, Lauren Brick, one of our certified genetic counselors and clinical leader in the genetics and metabolics clinic. So thanks and congrats to those three for just a little treat. Again, really distributing some donations that we've received. So we're out of time. I want to thank everyone for this week and for your forbearance as I maybe stumble through some pieces. I'm going to watch really closely again, the nature of the progression of the pandemic and with your help and advice, make decisions around cadence for this town hall going forward. If we need it, please speak up. If you need something else, please speak up. This is a time where we know we want to support you, and that's kind of front and center for my job and my mission. So with that, take care. Thanks, folks, for joining in, and we will hopefully see you soon. Take care.